and move.
Of course. Welcome and thank you, everyone, for joining us. Wonderful to meet new friends and current students. The EIR program is a very strong component of the Marion K. Shaughnessy Nurse Leadership Academy, which falls under the umbrella of the FPB School of Nursing. Members of the Alumni Relations and Development team are here, and we're so grateful to have our alum back, Jayme Ambrose, and a future alum. Thank you, Ethan, for moderating today. So feel free to take it away.
Absolutely. Well, it's my pleasure to welcome Dr. Jayme Ambrose, the visionary founder and CEO of Adobe Population Health. Welcome back to CASE.
Thanks, Ethan.
So I'm just going to tell everybody here a little bit more about Jayme. Jayme founded Adobe in 2018 and pioneered a tech-driven approach to interventional care, addressing health equity and supporting over 200,000 underserved individuals across 3 states. With a doctorate in nursing science and leadership from Case Western Reserve University, Jayme's integrated care model bridges critical social determinants of health, connecting patients with essential resources and reducing healthcare costs, like we were already talking about.
Yes.
Beyond her work at Adobe, Jayme teaches at Arizona State University and actively serves on multiple healthcare boards, continuing to drive innovation and compassionate care in healthcare. Please join me in welcoming Dr. Jayme Ambrose.
Thank you, Ethan.
Absolutely. We're so glad that you're here. So all laying down the groundwork. We're interested, what inspired you to pursue a career in nursing?
You know, I didn't make up my mind to be a nurse until one day, one of my brothers fell and scraped up their knee. And I was cleaning it up and putting a Band-Aid on it. And I thought, oh, I think I'm going to be a nurse. I think this is what I want to do. Up until that time, I thought I was going to go to law school, which I'm so glad I didn't.
Sure, absolutely.
So that's what led to it. And my aunt was a nurse. She was a surgical nurse. So having conversations with her as well.
So with that background, then you got your diploma in nursing, correct?
Right. I went to a small diploma school in Indiana that was affiliated with one of the hospitals, and graduated from there and went to work in a small hospital. So my career path has been a little different. I only have ever worked as a hospital nurse for 6 months. I hated every minute of it. I did not enjoy it at all. So I moved from there and went into psychiatric nursing. I worked on a forensic psych ward. And then from there, I went to a local mental health center, ran that mental health center, ran their emergency services program, their after hours program. And then transitioned to an even more interesting, I went to work for the world's largest distributor of fresh meat as a work comp case manager. And I really didn't know anything about it, but when you're a psych nurse, especially doing what I was doing, you do a lot of care coordination. And so that was really the core of what being a work comp case manager was. And I went into it also with the understanding that it needed to be a very holistic approach. And so I got the job because the plant manager said, well, what do you know about working with employees? And I told him what the psychiatrist I worked for told me all the time. He would say, my dear, we are all crazy. Just some of us have jobs. And so basically he said, well, I think you're right. And so I got that job and created then a holistic case management program and ended up working for their corporate offices, setting up the case management model throughout the 29 fresh meat plants.
Wow, that's incredible. So not only, so you did a brief stint in bedside, but then leadership, and you helped run the mental health center that you
Yes.
discussed. and then into case management, and then very broad case management at 29 facilities, I believe you
Yes,
mentioned.
yes.
So that's quite the background that led to,
Yeah, so after that, I moved to, I met my wife, we moved to Arizona, and I went, back to school, to get my, BSN and MSN. My master's is in community health nursing, which, I have a very strong passion for. And, from that, I then, worked for a hospital system as, the director of corporate and community health. And that allowed me to really gain a lot of knowledge about business management. My boss was the VP of strategic innovation.
Wow.
So I was able to, as programs were failing, we would work together to identify how to improve them. And really learned budgeting and those pieces of it. And that then, really helped create my business acumen from a nursing perspective. And when I was finishing my doctorate, I stopped working at the hospital and went to work for a very small business as their chief clinical officer. And the opportunity arose where my partner said, I don't want to do healthcare anymore. So I'm gonna sell off all these components, which we had home health, hospice, non-emergent medical, we had caregiving, which was in-home attendant care. And then we had Adobe, which was the program that I had created, and palliative care. And so I went home and I said to Pat, I said, we need to buy Adobe because I believe in it and we need to purchase it. And she said, well, I'm semi-retired. I don't really want to do that, but she did. And that's how Adobe came to be.
that's great. And talk about being with the VP of strategic innovation, because that's a lot of what Adobe is some strategic innovation.
It's a lot of innovating.
Yeah.
Absolutely it is. But, Adobe also wouldn't be where it is. I mean, that from a work perspective, but I also was given the opportunity to come to Case and get my doctorate. And while I was in Dr. Fitzpatrick's class, we had to develop a model that we wanted to sell. And my partner and I, my good friend Karen Bansky, she and I put together this model with a couple other team members. And we actually, the model was, how do we reduce rehospitalization rates? And it was by partnering with managed care plans, putting people in the home post-discharge. And we presented it to the class, and Dr. Fitzpatrick gave us all her money. So that's how we started it. No, it was pretend. It was pretend. But when I got out and I met Michael at Beach, he said, this is a great idea. We've got to find some place to pilot it, which we did. And after the pilot, then we got our first contract.
Excellent. And when you started at Case, did you envision that you were going to go down a path like this?
No, I did not. I was very much a traditional thinking, non-entrepreneur, that I'm gonna stay at the hospital system, I'm gonna retire from there, I'm gonna keep putting money in my 401k and live a comfortable retirement. In fact, when we first moved to Arizona, Pat, who is an entrepreneur, she said, we should start our own business. And I said, no, I'm never gonna do that. I'm absolutely never gonna do that. But when I went to work for Michael, and he said, I don't wanna do this. And basically it was, we had one contract, we had 12 employees. And with that contract, we had the opportunity to prove something. And if we had not bought the contract, he would have just closed it, right? Because there would have been nobody else who would have
Sure.
wanted to buy it. And really the emphasis was how it was to ensure that those 12 employees had a job. For at least the next year, right? While we figured out, are we gonna keep this company? Are we gonna let it go? What are we gonna do? And that was really why we bought the company, was to make sure that those people kept their jobs.
Wow, those connections that you have with those people, you felt like you had to at least give them another year, try to make it work. And after that, then what happened? Because now it's more than 12 people, right?
Yeah, so of those 12 people, 8 of them still work for us. Every single one of them is in a leadership position. We're currently at 400 employees, and we're currently in 8 states. We started out with 4,000 lives. We're at around 400,000 lives. You know, that first year, it's a risk, right? Pat worked as the HR director and paid all the bills and got no salary,
So
and
much for retirement. Huh?
so, you know, it's very, very different now. So it was never like, we're gonna buy this and we're gonna make it huge, and it was really, let's just see what happens. And because the model works, right? That first contract, the VP, basically, he said, Jayme, he said, I love your idea, but here's the bottom line. We're losing money in this county. It's a very rural, southern Arizona county. In fact, you can stand on a hill and you're looking at Mexico. That's how southern it is. And he said, so if you don't get us to at least break even, we're pulling out of the county, and you won't have a contract. So we knew we had a year, right, to prove ourselves. So we were able that year to bring the cost ratio down to 95%.
Wow.
Last year it ended at 79%. So that allowed us to prove, right, that the thesis which runs the company is, if you improve quality of life, healthcare costs will go down. And what also has happened is that we've been able to prove that year after year in different states.
And I just want to acknowledge the perceived team, the VA Purchase Long-Term Services and Support Leadership, VA National Center for Ethics and Healthcare. They've been great partners in this work and the career program. Thank you.
Oh, here we go.
I got it.
Sorry about
I got
that.
it. No, that's fine, that's fine.
So yeah, as you were saying, you're bringing down the cost and bringing up the quality of life of your patients in that county. So being a formerly 401k, 40 hours a week mindset, how did it feel in that first year when you had those 12 employees that you were going to try to get through to the end of the year?
I didn't sleep.
Yeah.
Of course, I don't sleep much now anyway, but I didn't really sleep because you have that added responsibility.
That weight on
Right.
your shoulders.
And of course, we didn't have a 401k. And you know, it was just, I think it was the added responsibility of making sure that those individuals, because Pat and I, we would have figured it out, we would have been fine. But and not to say that they wouldn't, but we both felt a huge responsibility of, we've got to figure out how to make this work. We've got to create a company culture that allows these employees to feel respected so that they can do their jobs. The mission that runs Adobe is to positively impact the lives we touch. And we wanted to and have made it so that our employees are also positively impacted. So as we've grown, the biggest thing that has been our focus is, how do we maintain that culture, right? Because when we started, we were all in one room, right? It was me, the call center, our currently now our COO, our IT team. We're all in the same room, so we're all chatting all the time. you know, every Friday, I would stand up and do a rock and roll quiz to educate them on the finer points of rock
Yes.
and roll. And, you know, I would stop in the middle of the day and just play a song. And so it was really, how do we maintain that culture? And we have spent, oh my gosh, so much time, energy to make sure that that's happened. And we still do rock and roll quizzes on Friday. Every Friday is Rock and Roll Friday. Put on your t-shirt and your jeans and come in, and we spend the, you know, time playing ping pong or whatever is happening. And that was really a crucial piece. And then also as we've grown, you know, we do have a 401k with match. We pay, we provide up to the 5,200 tax allowed for education. You know, we pay for community days for our employees to work in the community. So all of those things we've continued to build as we've been able to do that.
So hopefully while you're in town, you'll be able to go see the Rock and Roll Hall of Fame.
Actually, I've been there twice,
Okay, excellent.
but I know that it changes all the time. I'm a huge Janis Joplin fan, so the first year that we were here, her Porsche was actually there.
Wow, that's
Yeah,
cool.
it was very cool. I have a picture.
So you mentioned the model for
Mhm.
Adobe multiple times. Can you explain what does Adobe do and what is the model? And can you introduce Maslow to us?
Absolutely, absolutely. So the model of care that Adobe does is integrating technology. We've always been very technologically based as a company, lots of data analysis, lots of pulling in data. We created our own software, and all of that allows us to efficiently do our jobs and to really target specific populations. So we take that data and then we marry it with the human touch. So we have an integrated model of care, which includes physicians, nurse practitioners, social workers, we have dietitians, we have pharmacists, we have our care navigators, which are either EMTs or medical assistants. And all of them work together to fill those gaps. Now, as I said earlier, the thesis that runs Adobe is if we improve quality of life, healthcare costs will go down. So from the very beginning, we've been identifying what are those social risks? Do you have enough money for food? Do you have a functioning toilet? Is there a hole in your roof? Is there a bobcat in your living room, which we've actually had happen? So all of those things are addressed first. So we created an app, which is called Maslow, which helps us gather that data. It then geolocates the closest resource to that individual. So it's not a zip code of here's 20 entities that are within your zip code. It's like, this is within 5 miles of you, this is in a mile of you. And it's really based on the answer that you give. Do you have adequate transportation, or, you know, how do you get, so that then determines the geolocation. And that then connects us with connects them with a social worker if we don't already have one in the home. So we identified those issues first, and then we focus on what are the healthcare needs, right? So what is your hemoglobin A1C? Well, if I don't have enough money for food, I don't care, right? I'm gonna eat whatever I have available to me. Do you monitor your blood pressure? Again, if the utilities aren't on and I'm having to deal with heat or cold or whatever the issue is, I'm not gonna be managing my blood pressure. So it's not, we go in with that attitude, right? Is that following Maslow's hierarchy, safety and security before we get to sense of belonging, which is really when you start identifying how you provide good self.
Yeah. And I know that I would have high blood pressure if I had a bobcat in my living room. Medication to fix that, that bobcat would have to go, but
Well, the issue was that she had a hole in her floor.
Oh, wow.
So the bobcat just needed someplace warm, so she just shut the door to her living room. So when the social worker got there, she was like, what's happening? And she opened the door, she goes, well, the bobcat won't get off the couch.
Oh my gosh.
Cause it was cold outside.
Yeah, right.
So,
Wow, well, yes, absolutely, then in your case, you do have to identify and treat those problems. There's no point in trying
there's
to,
absolutely no point.
no new amlodipine prescription is gonna fix that.
No, there isn't.
situation.
No physician, no additional physician visit is gonna fix it. And that's really, I think, the issue is that it's very, very simple, right? Do I have enough money for food? Am I living in an environment that I feel safe in? Then I can worry or focus on, not so much worry, but then I can focus on how do I improve my health? And so we take the data from Maslow. And because we've been in the one county for now 7 years, we're able to do a look back from a claims perspective and say, okay, here's all the claims for, we'll just say the Bobcat lady. Well, here's all the claims for the Bobcat lady, and then here's the time
The
when.
cat scratches, the high blood.
I don't think that, no, she never got that close, but here's all her claim costs. And then here's when we did our intervention from a social risk standpoint, and then here's her claim costs afterwards. And basically what we're able to prove is that once we address that social risk, claim costs go down by 30%. So we're validating the thesis.
That just occurred to me, is that population health and preventative care is hard to get metrics on, but because by using your claims data, you have now you have a data-rich environment to
Yeah.
prove that your Maslow interventions are really
Yes.
helping a lot.
Yes.
That's so cool, actually, and that's a phenomenal use
Yes.
case about incorporating that tool.
Absolutely.
So what are some challenges and how did you overcome them when it came to bringing this to market and bringing this tool on board?
Well, I think some of the challenges have been most often I'm the only woman in the room, and I'm also the only nurse. And I've been in some meetings where it's a different discipline-led group, and they'll say to me, oh, so you're a nurse-run company? And I'll say, yes, that's what's on my website. So I think getting over maybe that barrier, but once we're able to prove what we do, so maybe, so a perfect example is, we start off in a state with a health plan, and they say, well, show us what you can do with this small population. And once we've proven that we can do it with this population, we now take on the entire population. So in Arizona, as a perfect example, we started out with 4,000 lives, right? We now have 50,000 lives. So it's really just proving it. I think that's the big thing. And also understanding that when you go to contract, it's not like you have one meeting and everybody's like, yeah, this sounds great. We're gonna do this, and then next week you get the contract. No, it's a year, a 2-year wait, and so you have to be patient and diligent and maintain your relationship and have those conversations. So
I really want to talk more about how your experience has been being a nurse-run company and a female-owned company. But I also wanted to ask, when you talk about, that made me think of this, when you go from 4,000 patients to 50,000 patients, and when you went from year 1 to year 2, and then year 2 and year 4, how has things changed as you scale, and what challenges have you had to overcome in that?
So I think one thing that's changed is I don't know everyone that works for me, right? I'm not in the same room. In fact, our office is, I don't even know how many square feet it is, but it's pretty big. And I walk through and I'll be like, yeah, I don't even know your name and I don't even know what you do, right? So that's the thing that leads to, the shift that had to occur. I'll just say that people think that I'm a bit of a control freak. I don't. And truly, when the company started, I had to know every single thing that was going on. I had to have my finger on the pulse of what this person was doing and that person was doing. And about 3 years ago, we had grown significantly. We were at that time, we were in 2 states, but we had over 200 employees. Our revenue had grown. We were, we were shifting. And we were having a crisis of culture within our company. My leadership team, as I said, they were all, most all individuals that were young, innovative, but their leadership skills were limited to what was happening at Adobe. And so we went through a very turbulent time of where we all had to make decisions about who we were going to be and what Adobe was going to be. And so a lot of introspection, a lot of self-reflection. And for me, it was, I've got to let go. I've got to trust that these individuals that I'm trusting are actually going to be able to do their job. Because if I don't do that, they're never going to be able to grow, right? They're never going to be able to be the individuals that I see in them, that I want them to be. And so that shift happened. It was very painful, but on the other side of it, we have grown, and the growth from a personal standpoint has been phenomenal, and our ability to do more of the good work has just been amazing. So.
That's awesome. And yeah, I can absolutely understand that would be very hard when you have such ownership. When you've had that, the weight of having those 12 people get through that first year on your shoulders, you feel a lot of ownership to make sure that things are going to be successful. So I can appreciate that would be hard to kind of step back and trust your people that they're going to do. And clearly they have done a great job.
They have, and I think, and when you're in it, you don't really understand. You're just feeling it all, right? And I had someone say to me that how rare it was that an owner, a founder owner, was willing to let go. That was number one. And number two, that the people that they started with are still working for them. And we've been able to do both of those things and be very successful at it. And it's really, again, I firmly believe it's the culture. I mean, the culture is the lifeblood of what runs Adobe.
That's awesome. Let's go back to what you were talking about when you were talking about being a female-owned business, female CEO, and nurse. So can you talk more about those challenges in the market and challenges in leadership as well?
Yes, in the market, when you contract with health plans like we do, it's a very male-dominated environment. It's become more prevalent actually in the past couple of years, where there'll be more females in the room, but it's very male-dominated, and it's also dominated with the idea that only a physician knows how to fix this, because the physicians are the core of primary care and hospitals and all of that. So our model is out of the box, right? We work with physicians, but we're not a typical population health company who is partnering with physicians and then paying physicians to do certain incentives. We don't do that. We do them ourselves. So an example is how a health plan is set up is, especially Medicare Advantage, is that there are specific preventative screenings that have to be done, and then the health plan is held accountable for those. And absolutely, you want the primary care doc to be doing monitoring blood pressures, hemoglobin A1Cs, diabetic vision screenings, and there's a whole long list of them. The issue is that the primary care doc, especially in rural communities, they're seeing 40, 50 patients a day.
Right.
So now you're telling me, and you want me to keep all this data? And you want me to submit these claims that I get paid nothing on? Yeah, probably not. I don't have the time to do that. I can't have anything interfering with my ability to see my patients and, you know, to do what I need to do for them to keep them well. So we step in and we then take on that responsibility. We do the hemoglobin A1Cs, we do all of those things, and then we give that information back to the primary care docs. So that kind of flips the model, right?
Mhm.
So that's what creates that also that gap in understanding of what it is we do and how we do it.
Excellent. Well, I can go on for quite a lot longer. I haven't even gotten through most of my questions I've written down just because it's so interesting to talk to you, Dr. Ambrose. But I want to open up in case there's any questions from anybody here in the room or in the Zoom.
I'll give the Zoom another second to load any questions, so we'll start in here.
Hi, my name is Isa. I'm a current senior at Case Western studying chemical biology, and I actually had a little stint at the nursing school. I started off there.
Okay,
Realized that wasn't actually for me, and I have so much respect for the nursing world from that experience. And I was really curious how you kind of learned to be a business owner and manage, like, maybe not having as much contact with people, with patients. Because obviously you have to have a balance with that. Your contact now is with like people you work with, or maybe patients to some extent. I'm not really sure. But
Well, yes, so I can, so when we started the company, I was in the field. I was seeing patients and I was, you know, I had my own I had a caseload of patients that I saw, and I was going into patients' homes and doing all of that. And over time, my ability to do that isn't there anymore. What I do now is I travel all over the country meeting with other CEOs and negotiating contracts. That's really my job. And so what has kept it alive for me is that I do continue to meet with the staff, and I continue to meet with my nurse leaders who run our integrated program, and I get the positive stories, right? So we had a member that was up in Reno, where there's lots and lots of snow in Reno, and we couldn't get a hold of them, so we went out to see them. And when we got there, their ramp was frozen, so they couldn't get out of their home. Their pipes were frozen, so they'd had no water, and they'd been drinking nothing but Pepsi for the past week. And so so that's the kind of thing that I get to hear. I get to hear stories like that all the time, and that helps me, you know, stay in touch. And also I still do, you know, some program development. We just launched our first perinatal program. So we're working with Medicaid moms, pregnant moms, and that's been a phenomenal experience. So I'm able to keep my finger on the pulse of what's happening with our patients, and we do community events, and I do attend those. So I meet patients there as well.
really cool. I also really wanted to commend you because it's so cool. Not only do you offer value, obviously, to patients, life-changing value, but also to hospitals and to doctors who don't have to spend as much of their time doing those claims, and to the hospitals because now they're getting more data. So I think that's really cool. It's all of these players that are getting positive
Thank you,
benefits on
thank
it.
you.
All right, I'm Jarvis. I am a biomedical engineering senior undergrad right now.
Mm-hmm.
And you bring up one aspect that I really want to ask is how you merging different brains between young generation and old generation. I'm gonna be honest, recently I've discovered that, like, cause I've talked to alums, graduate like 6 years earlier than me. Their way of how they do things, their way of communication is totally different. And like, and I'm always trying to learn how to be the bridge between different generations and connect to even generations younger than me. Can you teach me some like secret sauce on that?
Well, I think, we have employees from the age of 18 to, 75.
Cool.
So, the one thing that resonates with everyone is music, right?
Yes,
So,
I totally get it.
yeah, so my 75-year-old, she was at Woodstock.
Yeah.
Do you know what Woodstock was? Oh my gosh, okay. Okay, well, Woodstock was the most famous rock and roll event ever. So Google it. But she was at Woodstock. And so we are able to, every meeting that she's in, I say, Karen, tell us about being at Woodstock. And you know what she says? If anyone tells you they were at Woodstock and they can tell you what happened, they weren't there. Which, what does that do? That connects everyone in the room and makes everyone laugh, and then creates that ability to see her, not as a 75-year-old semi-retired nurse, but as a human being with experiences that everybody can share in. And so when we do, Rock and Roll Friday, it's not just everybody in rock and roll t-shirts, it's whatever band they're interested in. And then we highlight all of our employees, like what's your favorite music and all of those kinds of things. So it's built into our culture. Now, I will be completely honest with you. We use multiple ways to communicate. We use Teams, which, you know, everybody loves Teams. We use email. We all have phones, and we also can walk into each other's offices. And I think one of the biggest barriers is understanding which is the best way to communicate with what individual. Now, if you were gonna call Karen, you need to call her, right? Don't text her, don't email her. You need to pick up the phone and say, Karen, what's up, right? Because of the age. But if I was gonna get in touch with you, I'd just send you a text, right? I'd just get on Teams and say, hey, what's happening? So it's really understanding that. And so many times I'll have people in my office and they'll be talking, well, this person did this and this person did that. And I'll say, what did you do? Did you have an email war with them? You know, that's what they did. They had an email war. And I said, and I'll say to them, get up, walk into their office, sit down, because guess what? Neither one of you gonna be a bully looking each other in the eye, right? So the core of it always is how are you communicating? And when all else fails, it's that eye-to-eye conversation that is gonna make the difference. So stop texting, stop emailing, get up and go meet with them.
Thank you so much. I'm gonna say that I have a good advantage right now because I listen to any kind of music, even different languages.
Oh, there you go.
And I like soft rock
Huh? Cool.
better than rock and roll, but but I do listen to every
Well,
single.
here's my favorite song, Janis Joplin's Summertime. So Google that, listen to
Oh,
that.
I know
and
that,
then-
I know that. Yeah, I know that. I have a play.
You and I, we're right there.
Yeah, and yeah, I actually kind of categorizing how different people communicate in my head and just use the most efficient one whenever I need to reach out to them.
Yeah, there's a
Yeah.
difference between efficient and effective.
All right, cool.
Right,
Got
you
it.
can write that down.
Yeah.
I
think
love,
that's
I love that, is that there's so many different forms of communication that now we're lucky to have all these different types, but maybe that's a problem too, so.
It can be, I mean, it makes it, I remember when my mom was alive, my brother texted her happy birthday, and she's like, what is this?
Yeah,
You
right,
gonna call me?
yeah, right, but if you call anybody in Gen Z, we'll be really nervous. Something's seriously wrong.
Exactly, exactly.
Okay.
So you were talking about earlier in your career when you were learning how to approach healthcare holistically. Can you talk about how you use that same approach but entrepreneurially? Like how you brought a holistic approach to starting a business? If you did, and if you did not, like what approach did you take?
Well, the model is holistic, right? So as far as how the business was developed from a holistic standpoint, are you talking about from a business principles standpoint?
Yeah.
So I think that, absolutely, we did that because we looked at all the different factors that were going to, how do we become successful in this area? And what are the metrics that we have to measure from the very beginning? Because our system is built on Salesforce. So the ability to capture data and utilize that data, we had that from the very beginning. So when I say that we have data going back to 2016, I absolutely do. So from a holistic standpoint, from the very beginning, when we would go into plans, we would be able to show them data, right? And then also looking at from that standpoint, also how do we increase engagement with that population, because that's the core of being successful. And it's not something that everyone can do well within the Medicare population. So when we look at that, it's like, okay, where do we hire the people from? Right? So geographically, where are we gonna be hiring from in order to engage with that population? So we have the data saying, this is the population we should engage with. How are we gonna get them there? And so it's looking at many, many different pieces. I don't know if I answered your question, but.
No, I think you did.
Okay, okay.
I have a question.
Sure.
Hi, so Shanina Knighton, research faculty over in the School of Nursing. So you mentioned with Dr. Fitzpatrick being in her class and being told, or I would say taught, to have this model to be able to sell. What are your thoughts in regards to how nursing school curriculum is now? And the fact that we do not have that traditional model of business and entrepreneurship and innovation that's taught within a curriculum early on. And I want to add on to that and say, how do you think that that can help with shifting nursing?
Well, I think that, which Ethan and I've talked about a couple of times now, I think that, and Britain said it, that's why she likes nurses, because nurses that know the solutions, is that, and understand it's been 40 years since I've been in nursing school, right? So how nursing is taught now, we were talking about that earlier. We gave each other shots. We didn't have a sim lab. But I think that that's true. But I think the one piece that happens with any healthcare entity, not just nursing, is that understanding that healthcare is a business, right? That's a big missing link. Because when you train to take care of other human beings, what you're focusing on is how do I keep this person well, right? And you're really, when it comes time for things to happen from a budgetary standpoint, you're only looking at how that affects you negatively, right? Because there's a dichotomy in that if I'm doing all this caring over here, I just want to be able to have the money to do what I do, right? And so if there was a more of an understanding that even Mother Teresa had a business plan. You know, in my career, I worked in a nonprofit, they were essentially free clinics. And I had a physician say to me, and I just learned this term was called a mercy heart. He had a mercy heart. And he said, I don't want to know about the money. Okay, well, I have to explain to you about the money so that you can understand how you can do your job, right? So understanding that you're doing as a nurse, this is what you're doing, but where's the money coming from for you to be paid, right? You know, how my company makes money, obviously, is we get paid by health plans, but we also take on risk. So some years we do great and everybody gets a bonus. And some years, you know, somebody gets bit by a rattlesnake and we don't do so great. So nobody gets a bonus. But I educate my staff to explain to them, this is how the money works, right?
Right.
And it's the same kind of thing. It's not that everyone needs to know the intimate details of your budget. But everyone needs to have an understanding of the financial components of what's going into how I'm getting paid, why I'm getting paid the way I am, and what are the barriers to that. Because if they understood that, they could help identify solutions when there are gaps,
Got it.
right? And nurses are great at that. And that's why I think nurses sell themselves short when they don't become entrepreneurs, because they're trained to be problem solvers. They're trained to have highly tuned critical thinking skills. And they're trained to be able to see things from a systems perspective, which in running a business, you have to be able to see things from a systems perspective, right? If I do this, how's it gonna impact down here? As a nurse, you know that. So that's my input. I don't think that's, just my opinion.
I had an opportunity to interview a CNO, and she said that she cares for her community by keeping the doors open to her hospital. And I thought, wow, that was really interesting, yeah.
Very true, very true.
So as I mentioned, I'm an engineer.
Uh-huh.
I'm trying to develop a medical device right now. And I realized one thing, that I don't know if I'm in the right direction now. But in terms of the money, in terms of the regulation, in terms of the reimbursement or selling cycle to hospital, capital budget, etc., it feels like I'm discovering the rules in a board game, in a Monopoly board. And these rules can change
Mhm.
based on years, based on who was elected to
Mhm.
office,
Mhm.
different kind of things. And
It can
I,
change based on regulation.
yes,
You know?
and also based on not only the US, but also different other countries too. And I just wanna ask you that, what is the common mistake of entrepreneurs missed looking at in that kind of rules that you have seen?
Well, I would say the common mistake of entrepreneurs overall
Yeah,
is giving up.
you know,
Things are always gonna be shifting. I mean, I can't tell you the number of times I was like, "Man, I can't keep doing this. You know, this is very stressful. This is a hard time. You know, the years we don't get to give bonus, that's a very hard period of time for me because we always give it at Christmas. I don't want our employees not to get that Christmas bonus. You know, that's so, and there's so many times when you're in a situation and it could easily not happen, right? You're waiting for a contract, you're waiting for a ruling to change, you're waiting for all of these things to happen, and it's just from an entrepreneur standpoint, you just have to know that it's gonna work out. You just have to know that. And I was just we were just at a meeting on Friday. It was a billionaire who was talking to us. And he basically said, here's all the companies that I had that I made money on. Okay, 3, 4, 5 companies. Here's all the companies I had that I lost money on, right? Or ideas or whatever it is. And I think that's the piece of it. Even in my in our short tenure, I've had great ideas and I could never sell them. I tried. I've actually opened and closed 2 businesses inside the business that I have because the one year I got a contract for a year and then I could never sell it again. And the other one, it was a great idea. I still believe in it. But COVID happened, right? So you just have to, you just keep doing and you keep knowing that it's gonna work. And I'm not a super patient person, but it has become my virtue.
I just want to give a shameless plug. So I co-teach biodesign over in biomedical engineering. I would highly recommend that you take that course. I can tell you one of the things that my students are often missing is voice of the customer. And so they don't talk to the people that are going to benefit or the entities that, like, let's say it's going to pay. So
Cool. I have seen that class
you
since.
should come.
Can I not sign into the class, just come to listen?
You should, because regulatory pays, we cover everything within a semester.
Cool, I would do it.
All right. I think we're running out of time. If I can.
How fast is it?
Hopefully quick.
Sure, depends on how long I talk.
Take your time.
What do you think differentiated your successful business, Adobe, from the ones that you tried to start that did not work out?
Well, COVID number 1, right? And also, I would also say to that one, that just as she mentioned just a second ago, I wasn't marketing it to the right people, right? And so if I do it again, which I would like to, I need to identify different people to be marketing it to. The other one, the reason that it closed was because it was with the CMS pilot. And the pilot, we got paid during the pilot, and then there was no sustainability for it within the company after that. But it really is, who are the stakeholders that you need to be working with? And if you put it in front of someone and it doesn't work, then find the next group. I mean, just do more research to identify who is it I really need to be putting it in front of. I just, and truly, I haven't had time to really invest in that. But I do think it's a cool idea. I just haven't got there yet.
So like product market fit would be a good idea.
Absolutely, yeah, you have to have somebody who thinks that it will work. And the other thing is, you know, the very first time we rolled out Adobe, we didn't make any money off of it, but we got a pilot, which allowed us to then get data, which allowed us to then market it, because we could say, this is the outcomes that we had. And so And what I said is, I can guarantee you, I'm gonna do this now, I couldn't do that, but I always do say, I can guarantee it. Sometimes I'm right.
Well, as we wrap up, Dr. Ambrose, I wanted to ask one final question. I'd love to know what fills your cup?
There are so many things that I enjoy in life. Obviously, I have, Pat and I have been married for 25 years. That's a huge blessing. We have a phenomenal family. And from a business perspective, to have taken a group of 20-year-olds, literally, they were in their 20s, and grow them into executives that, I mean, they're running the company. I'm not there. That has been a phenomenal experience. We've been able to see first generation college grads because we helped them get through school, who are the first one who've had a college education, the first one to own their own homes, all of those things because of what we've been able, because of the culture that we've been able to create. And so we are, oh my gosh, so abundantly blessed
Wonderful.
and rock and roll Fridays.
Excellent. Well, thank you so much for being
Absolutely.
here. This has been eye-opening. I'm sure everybody here has learned so much. I know I have.
Thank you very much.
So welcome back to Case and glad you're here.
Absolutely. Thanks for having me. I've enjoyed it very much.